Hey everyone, it's Dr. David here. Can y'all see me okay? Got my lights set up a little funny today. There we go, that's a lot better. Let me move things around. We're going to be covering the 10 best ways to reduce pain 1 year after having a knee replacement. A lot of people get knee replacements and they still have pain afterwards. They go through the rehab, they go through the recovery, they do all the physical therapy, they use the walker for a little while, then they have the big scar heals, the doctor follows up with them here and there, and overall they're moving better. Overall it's better than before when the knee was just really bad, but there's still some issues and it's not like they expected. And so that's what I want to talk about today is how to improve that kind of pain. So if you've got a knee replacement and you're still having issues, this is the talk that you want to hear. This is going to be beneficial for you today. If you're thinking about getting a knee replacement, this could also benefit you because you'll see what people deal with. You'll see some of the comments on there. We already got a few going on, a few comments coming through. And so it might be beneficial for you as well. If you're on YouTube and Facebook, I can see your comments. If you're on Instagram, we're live on all three platforms right now. I won't be able to see your comments, but let me just go through some comments here. Guys, let me know if you can hear me first off. I forget to ask all the time. George Villanueva is asking me to do something for treatment for elbow bursitis, all caps. He's yelling at me. And Gray's got some, okay, we got some questions. I'll get to those in a minute. Let's see who's saying hi. Nathaniel says Bon Tardy from Aruba. Cool, Aruba's in the house. Lori Wilson says, hi, Dr. David, how about those Ohio State Buckeyes? Oh, I'm going to get jabbed so much about that. That's okay. They put up a good game. Congratulations to the Ohio State Buckeyes on their win. I am so sad about my Longhorns losing, though. We got Anne Marie from Santa Barbara, California. Fantastic. Oh, here's Kimberly. She says, I can hear you. Thanks, Kimberly. I'm relying on you every week to let me know, Kimberly. You just let me know right away. Don't even wait for me to ask, Kimberly. Kimberly's always on our calls here, ready to help, ready to ask questions. Steve is here, says 12 days since total knee replacement, doing great, better than expected. Fantastic, Steve. This talk's for you. This is going to be perfect. Don't want you to have any problems moving on forward from here. All right, so we got clear that Kimberly can hear us. Dig Doug says he's in NorCal. Fantastic. Let's get to it then, guys. Let's talk about the 10 best ways, get my markers here, to reduce pain after 1 year from the knee replacement surgery. So number one, let's go with brown. I'm going to just do this right here. That means like no or quit. So I'm going to say no walking. You got to stop walking. And here's what I mean by this, because I take the stance oftentimes with a lot of different knee problems and hip problems, all kinds of lower half of your body issues, to stop walking if you're trying to walk through pain. Walking isn't always bad, but it's bad if it's hurting you. And there's cases even where it's not hurting you, but if you don't know how to fire the right muscles, then you're going to be hurting eventually because you're feeding into an imbalance. And so what people get told often as they're going through the recovery after a knee replacement, excuse me, they'll get told to start walking ASAP, like within 24 hours. They want you to stand up and put some weight through that leg. And that's good. That's okay, because the surgeon needs to see that everything is working fine in your knee replacement, that you could bear weight on it. I know you have an incision, a big giant incision. Who was it that commented here a second ago? Somebody that said they had a knee. Oh, Steve here that said that he had a knee replacement. So you're dealing with an incision right now, Steve. But after that heals up and you go through the rehab, you get all the knee bending back, you can straighten out your knee, you're basically getting back to life as usual. That's when I say stop walking. What people will get told at that time is, oh, you can walk for 5 minutes, 10 minutes now. Go ahead and get on the treadmill. Go ahead and start walking around the block. Go to the park and walk. They'll say things like that. And that's when I say, no. Don't exercise. Don't walk for exercise. It's okay to walk to do your basics, to get around your house, to just do your basic everyday things. That's fine. You have to do that, right? You have to go take a shower. You have to go to the bathroom, and you have to go feed yourself and take care of loved ones around you if that's your situation. Those are must do things. But going on a 10-minute walk or a 30-minute walk, that's because you choose to. And you might be given the wrong information, because if it's making you worse, don't do it. If you don't know what muscles you should be using when you're walking, you're just walking without ever thinking about what muscles you're using, you're going to make it worse. So make sure that you stop walking if you're walking right now, especially if you're having pain right now. This is probably going to be the best news ever. You're going to be like, oh gosh, thank goodness he said that. What should you do instead of walking? So let's talk about that. You need to here, instead of walking, is do, what's right here, offload. What I mean by offloading is using one of these, the cane, to put some pressure through your hand as you're walking and take pressure off your replaced knee. Because as soon as you get this out and lean on it as you're walking, you will instantly feel a reduction in pain, perhaps even no pain. You might need one of these or two of these and take the weight off your leg. You might not need to take the weight off completely. It might be okay to put a percentage of your body weight through that leg, through that knee that was replaced. But if you're thinking about it, whenever you're walking right now, one leg moves forward than the other leg. And so for moments, you're bearing your full weight on that knee replacement. And if you think of that as being 100% of your body weight, if you can use an offloading device like a cane, a crutch, or one of these things, walker, this offers you the most support. You can take off the most pressure from your leg this way. The cane is the least, the crutch is next, and then the walker gives you the most support. I know they're a pain to carry around and use. I was actually on a crutch the past couple of weeks because I hurt my toe pretty bad, but it's getting better. But anyways, if you take weight off your knee and then walk and it doesn't hurt, now you're in a better spot. You still have to figure out what muscles to use, though. That's key. What we're accomplishing, though, by offloading is not irritating it, so that you don't have that chronic pain beyond a year after your knee replacement. And by the way, I read a year because that's kind of like the expected recovery time after having a knee replacement. You're expected to, doctors will tell you different things. Some doctors will say, oh, 2 months, 3 months, and you'll be back to, walking around and doing some basic stuff. And then in 6 months, you'll be skipping and dancing. They say it jokingly. But in reality, most people that I've seen take 6 to 12 months. And it's on the shorter end, 6 months, for somebody who's like very healthy, was athletic and fit and is into exercising, because they just move through the recovery process a lot faster. And then 12 months if they're less healthy, if you're obese, if you've got other health conditions like diabetes, heart problems, or if you have like both knees involved, or a hip and a knee, you might have hip arthritis in addition to the knee arthritis. If you just have multiple issues going on, then you will probably take more like 12 months to recover fully. Now, you might be discharged from care from your surgeon within 2 or 3 months, but that's not, you're not done. You still got work to do. You're going to be very weak afterwards and adjusting to your knee. And that adjustment process is what I'm talking about. It takes about a year. All right. So as part of that adjustment process, what should happen ideally is you need to learn to walk. And this is not taught. This is not taught in physical therapy. I mean, think about it. You just walk, right? Right now, you can probably, as long as your knee's not really bad or the body part, you get up and you just start moving. But nobody talks about use this muscle, then use that muscle, use your feet this way, position your legs this way. And I'll break it down for you. This is the quick and dirty way that I tell people to walk. When you bear weight on one leg, you're say I'm bearing weight on my right side. Let's see if I can get, I can't mess with the camera angle too much because we're tight in this room, but I'll just get back a little bit. So if I'm going to bear weight on my right leg right here, my toes on this foot should grab the ground subtly. At the same time, my butt muscle on this side should tighten up a little bit. 10, 20%. Same thing with the toes, 10, 20%. And as I'm bearing weight on this side to move my other leg forward, my glute and my foot are working. And then as I bear weight on my other leg, now my left foot and glute are going to activate 10, 20%, while my right leg relaxes to swing my leg through. And then this is what you do in an alternating fashion to do walking. There's a few more variables that I explained. There's some There's some different situations that you might need to think about, but that's like 80% of the problem right there. If you can fix how your feet activate and your glutes activate, some people need to just learn how to activate. That's a big milestone for a lot of people. Once you do that, then walking becomes a lot more simple and straightforward, and you just have to kind of go through it. People don't always know to do this. Healthcare professionals don't know how to do this. They just say, go ahead and walk, get on the treadmill. And what goes wrong is if you're not using the right muscles, by default, your body just figures out a way to move. And it says, well, I'm just going to use the muscles in the front instead of the ones in the back. And we're just not going to use feet at all because we got shoes on and they're offering us a lot of support. So we don't have to worry about toes. And you just go. And it might feel okay at the beginning. You might not hurt. But after some time, muscles start to get too strong in one area and not strong enough in another. They get weak. And that puts bad forces through different body parts, your knees, your hips. And even though your knee joint is replaced, it's replaced, so you can't technically get arthritis there. There's other things there that are not replaced. There's muscle and tendons and ligaments and nerves, and there's still bone, the parts of the bone they didn't take out. So there's other things that could become painful if you continue with this muscle imbalance. So you got to make sure to fix that imbalance and learn to walk properly, offload if you're irritated in order to get this pain down a year after walking. Now, that was like huge information. That probably helps when I see people after a knee replacement, they're still having pain like that. These are the biggest things that I go through, and that probably solves 80 to 90% of their problems. But there's a lot more that I'm going to give you here today. So let's do number 4 next. You have to quit working on quads. Let's talk about that one for a bit because that will get talked about a lot. Steve, you still with me, Steve? You just had the knee replacement 12 days ago. I hope you're doing all right. Now, after surgery, like right after surgery, within, I'd say 2 to 4 weeks in that range after surgery, quad activation is very important because they make an incision. You have to cut your knee open to do the surgery to replace the joints. And your quad muscles are very likely to shut down. They put nerve blocks in them anyway to shut them down. And so right after surgery, you need to reactivate the quads by thinking about making them work. And you can look down at your thigh muscles and see the muscle work. Once it's active, though, and you feel like when you stand up, it works, you're using it for your everyday activities, even though you're healing from the incision still. Personally, I think that it's time to stop focusing on that. And now you got to focus on some other muscles. I'll talk about that in a second. But what tends to happen is right after surgery in the hospital, people that had a knee replacement get told, activate your quads, push your knee down, straighten out your leg, make the quads work. They call it quad sets. You do that while you're in the hospital, then you might get seen at home and do home health, and the home health therapist will come and visit you, the physical therapist, and they'll have you do quad sets because it's all about the quads to them at that point, which is appropriate. Then you might finish the therapy there, and then you might go to an outpatient physical therapy clinic where they're going to finish off your rehab. Maybe it's at the surgeon's office. That happens a lot. And they have you working quad sets there too. And they never really stop. And they never really they don't, it's not their specialty. I'll put it to you that way. That's not their training to know muscle imbalances, because what they're focused on at that point in your care, which is appropriate, is to get you to walk again, to get you to be able to move around in your house. If you need to go to work, to do the things you have to do. They're not there to fix your muscle imbalance. They're there to do the surgery and recover from the surgery. Fixing muscle imbalances is a different specialty than post-surgery, post-knee replacement care. In order to fix the muscle imbalance, this needs to stop. If you don't fix the muscle imbalance, which surgery does not fix the muscle imbalance, it just replaces the joint, then you're going to likely have pain for a year after the knee replacement or beyond. Some people have had a knee replacement 5 years ago and they're still having pain. And it's because of this. They're still working on quads and they haven't figured this stuff out. And there's more. We got 10 points here. Number 5. What we do need to work on instead of quads is glutes, the butt muscles, the buttock muscles. What should happen, I'm going to get a little sciencey here. Y'all follow me. Y'all smart. You can do this. There's this term. You don't have to remember any of the terms, by the way. I'm just going to say them, but you'll get the point. There's this term called reciprocal inhibition, which just means that let me do it with my elbow, as this muscle works, as it activates to bend my elbow, then the muscle back here, which opposes this muscle, because this one straightens out my elbow, this one bends it, this one has to shut down, it has to not work against this muscle. That would be an isometric contraction where you can't move down or up, it's just staying still. That's not going to be functional, right? You can't move in that situation. So what we need is for this muscle to work and this muscle to shut down. Same thing should happen in the leg as you're walking, except it's a little bit more complicated than the elbow. So as you move your leg forward, your muscles on the front of your leg are using some momentum to help bring you forward. But in order to propel your body forward, your leg's going to move backwards. And so this muscle needs to activate back here, the glutes. But what we often see happen is people don't activate the glutes. They don't even have the ability to at the beginning. Like they just haven't done it in so long that the glutes are shut down. And if your body's like that, it figures out other ways to still make you do things because you're still walking around. Walking should be a glute-driven exercise. You should feel your glutes working as you're walking. If you're on a long walk, you should get tired in your glutes. If you're not getting tired in your glutes, that's a problem. It means your glutes aren't active. You should be getting tired in your feet muscles too. I'll talk about that in a second. But if you're getting tired in your quads while walking, if you feel your quads activate most, then you're probably not using your glutes very well, and you have to flip it. You have to switch it to becoming more glute dominant because that's going to take the pressure off your knee joint and help resolve the pain after the knee replacement. All right, let's do the next one here. Marching along. Gonna bring out the red Sharpie. We gotta quit this one too. Quit strengthening your hams. Your right hams. Hamstrings, the muscles in the back of your knee. Now, because this muscle crosses the knee joint, so let me show you the knee joint. Here's a knee. There's a kneecap, so that's the front of the knee. This is the right. The hamstring comes on the back from the glute area, and it comes down past the knee joint and attaches to the sides right here of the shin bone. Because it passes the knee joint, it can compress the knee joint if it gets too strong. So we don't need super strong hamstrings. If you can bend your knee through the available range of motion you have, I say that because after knee replacement, it might not be the same as it was before the knee replacement. It might be better, it might be worse. But as long as you have good motion and you can bend it throughout, then and you can pick up your leg over things, like you can get into the car, you can get your leg over a tub, you can get over a step or up to a curb if you're on the street, then you probably have adequate hamstring strength. If you focus on strengthening your hamstrings, if you're doing hamstring biased exercises, then you're probably going to have an imbalance between these two muscles, between the glutes and the hamstrings, because the hamstrings can compensate for the glutes. Because they also cross the hip joint up top, they can take over for weak glutes. So if you have this muscle shut down, these two muscles like to take over. So it's not a good idea to be strengthening them because then you're feeding into the imbalance. This is the imbalance right here, part of it. So leave the hamstring exercises behind because you probably are already dominant in your you're probably already dominant in your quads and your hamstrings. So no need to further get them stronger because it's just going to be more dominant. It's just going to make the problem even worse. All right, where are we at next? We got do foot strength. The foot gets overlooked so much during rehab for knee replacements. People don't do it. The only thing that I see people do, like therapists do to help their knee replacement patients, is balance work. And so they'll stand on one leg, and that's towards the end of everything. And then maybe calf raises, and occasionally they'll do, so calf raises are just these where you're lifting your heels up. Heel raises is another name for it. And then they'll sometimes put their foot in a rubber band and have them move their foot this way and that way, up and down, like you're stepping on the gas pedal. But even then, it's rare that I see therapists give that exercise for people that have had a knee replacement. That's more for like an ankle issue. And then what you'll see in people that if you're in therapy and people have a foot problem, you'll see them picking up marbles, putting them in a cup. So they'll put marbles out like on a towel or on the carpet or something, and they have to use their toes like a monkey foot and put them into a cup. or they'll have to pick up like a pen. I've seen that one too, or scrunch a towel with their toes as well. And that's how they do foot exercises. But I think we need to think about it differently, because your feet are designed to be hands. Your feet are designed to grab things. What they're supposed to grab is the floor, but they don't grab it like fingers. You have toes that are like tiny fingers, but what they do is they just press down against the ground and they adapt to uneven surfaces. Of course, the world we live in now, a lot of surfaces are pretty flat. You might be in shoes, so that's accounted for. But if you were barefoot everywhere, and if we didn't have concrete floors, sidewalks, nice smooth surfaces to walk on in our homes, you would be walking in the wilderness on dirt, on uneven ground, and your foot is adapted to be able to handle that, so you can keep balanced. So what you should be doing, the way to train your foot, is to grip with your toes every time you walk. That's the most basic thing. If you can just do that, press your toes down. And the way to think of it is, if you think of fingernails, it's hard to see with the light here, but if I squeeze my fingertips right here, they turn white at the tips. That's called blanching. You want to just barely make your toe tips blanch, because your toes do the same thing. That's how much pressure you want to put through your toes. You don't need to grip the ground and clutch it super hard. You just have to press your toes down a little bit. And what you should feel when you do that is your arches will come up subtly. That means you're getting good support through your ankle, through your foot, through your ankle, and that translates up into your knee joints as well. And that's helping you out. So this muscle right here, glutes and feet, are going to help you a lot to combat the quad and the hamstring dominance. All right, let's go to 8 here. Robin says, I see Robin Lee Day here. Natasha Sava from Bulgaria. Fantastic. Cheryl Robbins is here from St. Louis, Missouri. Fantastic. Hound Jog is here from Germany. Awesome. I'll get some questions answered here in a second. Let me just keep going. I'm almost done here. We got a good question here about a knee replacement. We'll talk about that here in a second as well. Hound Jog is saying thank you. Elena says thank you for the information. Fantastic. Glad we're helping you guys out here. All right, what's number 8? So I have my notes. All right, this one's a good one. Let's talk about, we're quitting balance exercises. Balance exercises, I think, are overdone. Here's why. This is like completely going against my profession. I'm sure a lot of therapists are like, can't believe you're saying stop balance exercises. You might be doing balance exercises at home. And it makes sense at face value, because people have falls. That's oftentimes a reason for people to become injured and get a joint replacement, especially like in the hip. But the balance exercises I'm talking about are standing on one leg, standing on a foam pad, standing on a wobble board, and trying to see if you can go 30 seconds, 10 seconds, even just 2 or 3 seconds in some cases. Your balance might be very bad, and so it makes sense work on balancing as an exercise. And I get it, and it's not terrible. It's not like, I'm not completely against it, like, no, you should never ever touch it. If you did it, I'd be like, cool, that's fine, work on it. But what I think you're missing is if you work on strengthening instead, like getting the muscle to fatigue and burn, without having to put yourself in a situation where you're off balance. If you just work on strengthening, because I do this with clients all the time, we don't work on balance. We just work on strength. We get the muscles to tire out, and a lot of them don't like it because some of them haven't ever worked that hard before, but we need enough reps with enough intensity to get the muscles to fatigue. And we need key muscles to fatigue. Not these muscles, the red ones. We need certain muscles to fatigue, and we don't want to fatigue other muscles. If we can improve strength in a balanced way, meaning we're not making one side of the joint way stronger than the other, then by default, balance improves. You have no idea how many clients I've worked with that we've never once done a balance exercise. We just focused on strength, and then they come back and tell me that they lost their balance and were able to regain it, whereas before they couldn't. They just feel more balanced. They tried on their own to stand on one leg, and suddenly they could just do it magically longer without ever having worked on it. It's because of the strength. And it makes sense when you think about it. If you just have more strength in the right muscles, and it's balanced strength, I don't want to confuse you. It's we're not strengthening you into a muscle imbalance. We're strengthening you into the proper muscle balance, meaning the balance of strength around the joint. That translates to you being able to stand on one leg better without losing your balance, or recovering from a loss of balance so that you don't fall all the way down. That's much more beneficial and you'll gain improvements in balance much quicker than if you just work on standing on one leg, if you work directly on a balancing activity. That's my opinion on it. And I would love to see some research on it. There's none that I know of. I'm just doing it with my patients because it's working already. Why am I going to wait for the research if it works and my patients need it? Number 9. Ab exercises are key as well. And this is what you want to do instead of balance exercises as well. So these are the big 3. I got them all on the board for you now. Glutes, foot strength, and ab exercises. If you get those 3 key muscle groups stronger and you're suffering from a pain after a knee replacement, you've already gone to the rehab, you're done with physical therapy and the doctor, the surgeon, you're still having problems. If you focus on those 3 muscle groups, you're probably going to improve. Like, I see it happen consistently. Unless you have like a loosened hardware, which, situations where you need to have a revision, chances are you just haven't worked on fixing this muscle imbalance, because that's what got you to the knee replacement. That's what created the arthritis in your knee. And that problem just never got resolved. In fact, it probably got worse after having the knee replacement because you never addressed it. And then you had the incisions, and then it got weaker after the incisions, after the surgery. And then the rehab isn't focused on the muscle imbalance. They're focused on just getting you up and walking. So it still needs to be fixed. You still have a muscle imbalance. That's number 10 here. Kind of tying them all together. I'm already getting into it. I can't stress to you enough how important this is. I made it its own point because if you had a knee replacement, I'm thinking about you, Steve, and there was somebody else who asked a question here about a knee replacement that I just pulled up. You probably don't even know what what a muscle imbalance is. Like, maybe it's been mentioned, a doctor or a physical therapist might have mentioned, but I have rarely ever met anybody who knows how to properly define a muscle imbalance. They'll just say there's muscle imbalances, and they say it haphazardly, vaguely. They won't tell me this muscle's too strong, this muscle's too weak, and make a rational argument about it, because that's just not their training. I'm not expecting them to. I'm not like, being like, hey, you don't know this and I do. It's not like that. It's like, you went to school to be a surgeon. I don't know that stuff, and I don't want to. That's your thing. If I need surgery, I'll go talk to you. But if we can prevent surgery and fix the muscle imbalance, figure out which of the key muscles you need to work on first, or maybe it's 2 of them or all 3 of them, figure out you need to stop doing these other things that are hurting you or wasting your time. Now you can make consistent progress towards improving that pain so that you can get the most out of your knee replacement, so that you're not thinking you need to have a revision later. I see people with knee replacements jog, ski, do fun things. Like you didn't even know they have it's as if they never had a knee replacement. That's how good it is. And I think it's because they fixed this. So if you're suffering with a knee replacement pain right now, you had the knee replacement, it's been a couple of years, and you're still walking on this thing, you need to fix this problem. It's fixable. You probably just haven't found the right information. I'm hoping to provide that to you. All right, guys, I got some bonuses for you. True form, right? I couldn't help it. I make my list and then I keep going. I'm like, I just got to share this. So why not, right? Knee brace. This is a sneaky one, and I'll tell you why. In people that have a knee replacement, you would think the joint's replaced, it's fixed, and now it's done. Like the sentiment that a lot of people have that have had a knee replacement is I went to the last resort option. I had the joint replaced. It should be good for now. And they think that's it. Because there's nothing else you can do after that, right? The joint's replaced. The doctor will say this: you can't get arthritis anymore. It's impossible. There's metal in there now. Took out all the cartilage. There's just artificial parts. It's impossible for you to develop osteoarthritis on a prosthetic knee joint. And they're right when they say that, but there's other factors here at play. What I have found in a significant amount of people that have had a knee replacement is a loose knee joint. So the joint like wobbles a little more than their good knee, and they'll feel it. People will be like, yeah, it just feels kind of unstable. And it's likely a ligament problem more than anything, because the knee replacement surgery these days is pretty good. Surgeons that do this job, they're good at it. It's an incredible surgery when you think about it. Like, they're replacing a joint. That's, in my mind, that's like in the healthcare field compared to the engineering field. Let me use a simile. Engineering is to landing on the moon, as medical field is to replacing a joint. It's pretty incredible. It's like on that level in my mind. But sometimes it's not necessary to replace a joint if you do the right things. And after you replace a joint, you might still have problems. So I got solutions. Using a knee brace like this that has hinges on it, brackets, that offers a lot of stability. Not the sleeve, not the wimpy little sleeve that you just slide on. That could begin to give you some benefit. But if you have a wobbly knee, and you know it, like those of you guys that are watching this right now, and you're like, oh yeah, he's talking about me. And if you're not sure, you probably don't have it. Like, it's usually clear cut. People are like, yeah, that's my knee. It wobbles. I don't trust it. You need to be in a brace like this. And it might be months, maybe a year or longer. They need to be in a brace like this for your ligaments to scar down enough for your knee to not be wobbly anymore. And you might need to come back to it from time to time. But think of the alternative. Would you rather just wear this brace for a good year? Maybe less. It depends on how bad it is, how compliant you are, and resolve it, or get worse, live with more pain, potentially have a revision surgery, a second knee replacement. All day do this. This will cost you around $50 to $100, depending on where you are and what size you need and all that stuff. But these braces are awesome. We'll link in the description. It's a shock doctor brace. It's got the hinges, like I said, on the side. You need the one with a lot of stability with the hinges on each side that bend at the joint. It just controls the joint, so you're not yanking on the ligaments every time you step and walk on it, and making your knee joint replacement more and more wobbly as you keep going. So that knee brace could be clutch for, I'd say, like somewhere in the neighborhood of like a quarter to a third of people that have knee replacement. I've run into wobbly knees, loose ligaments in the knee replacement, and they need this. All right, what's next here on my list? I got a couple more things for you. 12. You got to learn stairs. And let me give a caveat to this one. I'm going to put a big asterisk, a couple of them, because some of you guys might be trying to do stairs that've had a knee replacement. Some of y'all that haven't had a knee replacement maybe live in a house with stairs, and they're just tough. They hurt. You don't like it, especially coming down. It tends to be worse than going up. And there's a trick to it. Like, there's a technique. There's a certain way to go up and down the stairs. But what I find consistently in people that have had a knee replacement is they don't have enough base strength to properly execute the stair climbing technique they need to. And so what I'm often saying is, like, okay, this foot first, activate your glute. I'm going through the technique on how, kind of like walking. I tell them how to use what muscles to use while going up and down stairs, and they're doing it, but they just don't have enough of this. They don't have enough glute strength, enough foot strength or abdominal strength. And the technique is just, it's not going to help them at that point. They're not ready to wield it. They're not ready to use it properly. And so they're just kind of gritting their way up and down the stairs. And what I'm having to tell these people is, you got to go get strength. You got to go do the basic exercises to push this and abdominal strength. So start with that. Don't beat yourself up if you're going up and down stairs and you're like, I can't get it. I saw Dr. David's videos. I got the failed knee replacement program. We have a program for people that have had a failed knee replacement. And he went over the stair thing, and I still can't do it. I just can't do stairs. It's not because you don't know how to do the stairs. If you've learned how, it's because of strength. You just need more strength in order to do the stair technique right. All right, 13 here. Actually, I got this one and 14. 14's good. Massage gun. And actually, 14 is going to be the opposite of 13. I'll show you why here in a second. The massage gun. Where is my massage gun? I'm going to step off camera for a quick moment to get my massage gun so that I can show you guys this one that I like. I'm not loyal to any particular massage gun. This is one that this one works well. They're all There's a lot of different models on the market these days, and you have to see which one you like. So it's got good battery, good power, all that stuff. Generally, the smaller ones have smaller batteries and less power. So there you go. It's a massage gun. Putting this through your quad muscles on your thigh can loosen up the quad muscles, and you can put it on your hamstrings. You can put it on other muscles that are stiff and tight. You want to use this on stiff, tight muscles because your muscles get stiff and tight when you overuse them. Like the quads, like the hamstrings, those are the two biggest ones. But I've seen people that with tight hip flexors, like right here, tight back muscles that can contribute to the knee problem as well. Even tightness in the calf muscles on the back of the lower leg below the knee. Using this to free it up can instantly relieve pressure in the knee joint and make you feel better. And this is not medication, so no side effects besides feeling good and making your voice sound buzzy and tickling your nose if you put it close up on your back. But so beneficial, and these are very, very affordable these days. So worth it for getting the pain to reduce and setting yourself up to do exercises. Because if you have very stiff, tight muscles, when you go to move, when you go to do an exercise or even just walk, the stiff, tight muscles are going to be the ones that want to work first. And it's because they have a higher threshold for activating. They have a lower threshold for activating. They fire really easy. If you've been training your quads and your hamstrings a lot, they're going to fire really easy. And so if you can get them to calm down with this and then think about using your other muscles, the ones that you're supposed to, glutes and feet, then you're going to put yourself in a position where you're going to be able to train these muscles better instead of failing every time and saying like, I went walking, I felt my quads kicking right away. It happens all the time. Right, last point here. And write it in red. This is kind of a long word here. Saphenous nerve. Just going to write a double N for nerve. Massage. This one's a unique one, and I want to highlight this one quite a bit because there's a nerve that comes off of the front of the thigh. So this is your knee here. Right knee is the outside. And so on the thigh right here, the nerve runs down. It's called the femoral nerve. And then it kind of wraps a little bit to the side and behind the knee slightly. And then there's some branches that go down the front of the knee right here. They cover this area. And when you have a knee replacement, where's the incision? Right here. They cut the front of your knee open, which means they cut the nerves there so that they can access your knee joints and cut everything out here and replace it. And then they stitch everything back together. You have a big incision in your knee afterwards. And there's a lot of patients that will tell me afterwards it hurts, even after months after, a year after, years after the knee replacement. They'll say there's a spot on the outside, just to the outside of the scar, close to the outside of my knee, that's numb. It's tingly. It's got a weird sensation. It's sensitive. There's all different kinds of descriptions that people tell me, and I have to explain to them the saphenous nerve, what I just explained to you. It's because the nerve runs this way across from the inside to the outside. And they cut it open, and some people are like, well, is the feeling ever going to come back? Is that sensation ever going to normalize? And I have to tell them, I don't know. They had to cut it. And then I've had some people get upset, like, oh, don't they know that? Why did they cut my nerve? And I have to explain to them, well, that's the best way to get into the knee joint, to replace it. And that's just one of the side effects of surgery. You might lose feeling in some areas, but now you have a replaced joint. You're probably walking better. You're probably moving around better. There's benefits to the surgery. There's an upside, but there's also a downside. So this is one of the things that people are discontent with or still dealing with pain 1 year after the knee replacements. And for some people, they could improve. And what you need to do if you have the ability to improve, which you're not going to know unless you try, is you need to massage the pathway for the nerve, which is basically you just move on the inside of the knee towards the front of the knee and to the outside of the knee. And when you're thinking about massage, it's not like with the gun. You don't massage nerves with this. You're going to aggravate a nerve. What you're thinking about instead is if you think of your skin, like on the back of my hand right here, my skin is mobile. The same should be happening on the front of your knee. So you need to grab the skin with your fingers, just kind of press down enough to not let the skin slip under your fingers, and just move the skin around right in front of your knee. Just like that. Excuse me. That is how you massage the saphenous nerve. And you're not going to feel the nerve. It's very difficult to feel. I can't feel it. I don't know of anybody that could feel it. Maybe if it's really flared up, but the point is not to find the nerve. It's to just get that skin right in the front of your knee to move around and just be gentle with it. And you could overdo it here. I tell people just a minute is enough, but you got to do it frequently, like 7, 8, 10 times a day, if you can tolerate it. Because if you do it once or twice and you're like, oh, my knee's hurting more, that's confirmation that doing this very light thing irritated you, which means it's probably a saphenous nerve issue that's causing your pain, your chronic pain a year after your knee replacement. And you need to just move around, like begin to get some exercise, maybe do some exercises for your glutes and feet and abs, and that's going to help your nerve move better. But also moving your skin is going to free up the space where the nerve lives. All right, guys, those are my 10, technically 14 points for ways to improve pain after a knee replacement, a year after a knee replacement. If you just had a knee replacement like Steve here, Steve Drake, let me put up his comment. Don't do this yet, Steve. This is for later. You need to go finish all your rehab with your physical therapist. Hopefully you're seeing one, and finish all the visits with your doctor. Do what they have you do, because you got to follow the post-surgery protocol. This is my disclaimer, by the way, guys. This isn't advice for day 2 after surgery or day 1 after surgery, even month 1 after surgery. This is for day 1 after you've been released from your surgeon and physical therapist. This is what you could start to do. And I've got a whole program, by the way. The program is called the Failed Knee Replacement Program. If you go to our website, you can go into our online programs and it's there. So if you're thinking you might need more help, I go into way more detail. This is just like touching on a quarter of the things that I talk about in the program. I have a lot. The program's packed with helpful information for you. All right, let's get to some questions before I got to get going. Let's start here with Ann Gray. Do you know much about, or can you recommend whether or not to get soft wave therapy for knee or hip pain? I don't know much about soft wave therapy, Ann. There's a lot of what we call modalities in the physical therapy world, which soft wave is one of those. Another one could be like ultrasound, electrical stimulation, infrared light, red light therapy. There's like heat lamps that people use. There's all kinds of little things like that. And the research is up and down. Like some people say that it helps, and there's a lot of information out there about this. My recommendation to people is always, try it out, see if it helps you. Make sure you see a professional who knows what they're doing, and make your own call. At the end of the day, if it's not fixing your muscle imbalances, it's not going to give you long-term relief. And so don't expect it to give you long-term relief. It might give you some short-term relief, which is good to help you get to the long-term relief, because you might be so irritated and painful that it's like anything that can take this pain down is going to be beneficial for you, so that you can tolerate some exercise. Then that's good. But if you're looking to do the soft wave therapy to fix knee arthritis or cure your pain after the knee replacement, it's not going to. You have to fix a muscle imbalance to get that long-term relief. All right, it's similar to like dieting. Like there's no magic pill. Well, I guess technically there is now with the pills out there for weight loss. But it still helps you control what you put in your mouth. Like at the end of the day, it's calories going in this way and calories that you're burning doing exercise. That's what brings your weight down or up. If there's some imbalance in that, and you can't just put a wrap on and expect to lose 50 pounds over time. You have to burn the weight off. You have to have less calories in and burn more calories. That's how we do it. With the pills these days, there's psychological pills that make you not like food, which is going to reduce your caloric intake. All right, so let's get into the next comments here. There's the jab from the Ohio State fans. I'd be jabbing if we had won. All right, Dig Doug says, is massage the best way to deal with scar tissue post-surgery? It depends where the scar tissue is, Dig Doug. If it's deep, which I find is rare, then motion is going to be better, like moving the joint. If it's superficial, like right under the skin, then you do want to do some massage, and the massage has to be done in a way where you're just like I was showing you. Think of moving the layers of tissue. There's skin layer, then there's a fat layer, then there's muscle under that, and then there's usually bone or ligament, other stuff. And so when I'm massaging a body part to help somebody recover from some problem, I'm thinking about all that. It's okay if you don't. You might need to just use one of these things, but you can kind of be guided by your pain. And what I mean by pain is not like pain like you're going to be in pain for the rest of the day, like you're creating an inflammation process. When you push into a body part, a muscle with this gun, and you feel a tender spot, that's what I mean. Because if you just hold it on that tender spot for a little while, 30 seconds later, it melts away. It's because you freed up the tissue. That's how I think that works. Dig Doug's in NorCal. Fantastic. Liz Beck says, hi from New Hampshire. So happy I found your channel. I am 2 weeks out from lateral and medial meniscectomy. Recovery is tougher than expected. Yep, it always is. Best of luck to you, Liz Beck. I hope you recover 100%. Please work on those muscle imbalances that got you here so that you're not dealing with a second surgery. I wish you best of luck. Elena says, thank you. Hound Jog says, thank you. All right, here's another knee replacement question from Kim Gibson. I hope you're still here, Kim. One total knee replacement at 1 year and one total knee replacement at 7 months. Okay, so both knees are replaced. One is a year ago, one is 7 months ago. Good flexion, but still having stiffness and tight band feeling. Yeah. Will that ever go away? That tight band feeling, I think sometimes it's related to that saphenous nerve thing that I was talking about. So if your flexion is good, that means your motion, your knee bending motion is good. The stiffness is usually related to the muscle imbalance, because if your quads and your hamstrings are over dominant, then they're pulling the joint up into itself. So the quads are right here on the front and they connect to the kneecap, and then they converge on this tendon right here that I'm moving, and it attaches to the shin bone down here. So it crosses the knee joint right there. And then on the back, you have the hamstrings that come down and attach to the sides of the shin bone. And when those muscles are very strong, they start pulling up and they literally press the knee into itself. It pulls this bone up into this bone. And even though the joint's replaced, it's going to feel stiff. So you got to go loosen the quads and the hamstrings up. That's short-term relief though. Long-term, you got to get the glutes more active, get your feet and your abs more active. And it's going to allow your quads and your hamstrings to not be as used. But you also have to quit strengthening the quads and hamstrings if you're doing that. As long as you're discharged from care from your therapist and your doctor, your surgeon. Hope that helps. It should go away, by the way. The tight band feeling is likely the saphenous nerve. That's what I've seen a lot. You might massage that out, but the saphenous nerve will become irritated again if you have that muscle imbalance. The muscle imbalance tends to irritate the saphenous nerve. It's possible that it could. Hound Jog says, good person. Thank you for your channel. You're welcome. Susan Corral says, hi, Dr. David. How do we distinguish good pain from bad pain, like weakness from low strength versus ouch, that hurts because I'm making it worse? Love your content. By the way, thank you so much. You're welcome. My best recommendation on this is good pain should be fatigue. Like you should associate it with being tired. And it's usually connected to some movement or exercise or activity that you're doing. That is good pain. And it should go away within moments or minutes after stopping the activity. That's how you can see when it's a good pain. And I don't even feel comfortable saying good pain. I'm just using your words here. I would call that's fatigue. That's just getting tired. That's making the muscle burn. That's good because you're exercising the muscle, hopefully the right muscles, so you're fixing the imbalance. Now, it's bad pain when you feel it in the joint, when you feel it in the nerves. The joint is probably the clearest one. If you feel it right here at the knee, let me show you my own leg. If you feel it here, anywhere here, there's not a lot of muscles here, so you shouldn't be hurting there. But if you feel it here, you're working out the quads. You feel it back here, that's glutes, that's good. You should be working it here anyway. But anywhere in this area, that's a lot of muscle. And it's muscle burn, which is I'm saying is the better one to have here, but you got to be careful about which muscles you're working out. Figure out the muscle imbalance for yourself. I hope that helps, Susan. All right, got time for a couple more here. Marine says, what is quad pain and back of knee pain in chondromalacia patella or patellofemoral pain syndrome? Quad pain or back of knee pain. Okay, so I'm trying to understand here. If you have pain in your quad, it could be a strain, like you overdid it with your quads. That happens because they're dominant and you shouldn't be working them out. And usually the glutes are too weak. You need to be working those out instead. But if you overuse your quads, people get to a point where their quads start to hurt and you can get tendonitis because there's constant tension on the tendon right here and down here where it connects to the shin bone. And people start getting tenderness around their knees. And that constant pressure pulls the kneecap up against the thigh bone. That's what causes the chondromalacia patella. So you got to not over strengthen your quads. If you're having pain in the back of the knee, that's associated with a lot of compression through the knee joints as well, because usually the fluid will start to pocket out back here. Eventually, it can cause things like a Baker's cyst, especially people that have knee arthritis. That Baker's cyst, it's often thought of as like its own separate diagnosis, but I see it as a symptom of knee arthritis. Your knees being squashed, and as a result, there's fluid in there that normally is in there to help lubricate the joints and nourish the joints, the cartilage, but it can also protect. It slightly acts as a cushion. It's more the meniscus and the cartilage. But if in an emergency situation, you'll generate more fluid in order to protect itself, and if it just keeps generating fluid, it starts to expand into the back of the joints, and that can be painful. There's nerves back there; it'll push into it. But it's because of that imbalance, putting too much pressure through the knee joints. I hope that helps you. And the difference between chondromalacia patella and patellofemoral pain syndrome, it's the exact same process happening. You're getting too much compression on the back of the kneecap against the thigh bone. It's just that in chondromalacia patella, there's some visible cartilage damage on the back of the kneecap that shows up on the x-ray. In patellofemoral pain syndrome, the doctor will tell you your x-ray looks fine. Your MRI looks fine. There's nothing wrong with your kneecap, they'll say. But you might have a lot of pain. You might even have some swelling, and it's because your quads are overly tight and they're yanking up your kneecap against your thigh bone, and it's working on chondromalacia. It's getting you towards chondromalacia patella. Right now, it's just patellofemoral pain syndrome. It's not that bad yet. To me, it's like overweight versus obese. And that's just the start of it, because that same problem will cause a meniscus tear later on in life, and then it'll eventually cause knee arthritis. And if you keep going, it'll push you into a knee replacement, which is, if we're using the same analogy, morbidly obese. All right, we got time for one more. From Apache Junction, Arizona. Fantastic. Southwesterner here in the house. Do you have any opinion on shockwave therapy, specifically for a rotator cuff injury, but also in general? Great question, Katie King. Same as like what I was saying earlier with soft wave therapy. So there's soft wave and shock wave. They're different wavelengths and different machines, and they market themselves different. And I don't have anything against them. If you go out there and use them, by all means, go for it. That's fine. Just don't look to that technology to fix the problem. I've heard some people say that it regenerates tissues. I don't know about that. Even if it does, if you have that imbalance and you're squashing your cartilage because you have the muscles are squashing against they're pushing your thigh bone into your shin bone, or your kneecap against your thigh bone in your knee, or if you have a replaced knee, it's pushing your replaced parts on each other too aggressively. The shockwave therapy is not going to fix that. You have to fix the muscle imbalance, but it might help you not take medications right now. It might help relieve the pain so you can exercise, and that's good. So use it for the right reasons. Just know why you're using things. That's the biggest thing here. I can answer this question from Hound Jog. If you have a flat bottom, does it mean you have weak glutes? Thank you. Yeah, usually it does. This is the old man butt is kind of something that was trending a while back in social media. Maybe it still is. The idea that older men tend to have flatter butts, and it's usually because they have weaker glutes. And I've seen this happen time and time again, where they have to wear the belt tighter, or they put on the suspenders. It's because you should have a little bit of meat back here that your pants sit over so that they don't fall down. But if you lost your meat because you have a big imbalance, you don't have glutes anymore, you got plenty of quads and hamstrings, and then the other imbalance that happens is they'll get big back muscles, and they'll cause back problems that way. That's usually a very clear sign that you don't have a butt and you don't have butt muscles working for you very well, and there's a big imbalance, and that's probably why you have your knee pain, hip pain, or back pain. So you got to fix that. All right, guys, that's my time. It's a pleasure hanging out with you guys. I look forward to being here with you guys next week. Have a wonderful week. See you guys.